Good evening, I'm Melisa Idris.
And I'm Shaarad Kuttan.
Welcome to Consider This. Now, yesterday on the show, we had Datuk Latif bin Haji Abu Seman, the Director General of Malaysia Productivity Corporation, or better known as MPC. And he was on the show talking about how to make it easier to do business here in Malaysia. He's back on the show with us today, and he's joined by Datuk Dr Jacob Thomas, Group Medical Advisor of Ramsay Sime Darby Healthcare. He's also the former president of the Association of Private Hospitals of Malaysia for the past 10 years, and he's just relinquished that role. Welcome to the show, gentlemen.
Yeah, thank you very much.
So today we're going to be discussing the Private Healthcare Productivity Nexus, which is the collaboration of the public sector and the private sector to increase the productivity of the healthcare sector. Now, Jake, I understand that you are the champion for this nexus.
That's right.
But before we get into that, I'd like Latif to kind of set the scene for us. I mean, there are 9 nexus of productivity, right? Healthcare being one of them. Could you help paint a picture for us?
Yeah. Under the Malaysia Productivity Blueprint, which came into force in May 2017, there are 9 sectors that the government has given priority, and one of them is the private healthcare. Now, the productivity outlines very clearly. It is about looking at productivity as the game changer. All right, the economy needs to grow, and we're looking at productivity, to spur the economy of the country. So we have the 9 sectors. And these sectors, we have what we call productivity nexus. They are the center for productivity improvement. And these centers are led by what we call productivity champions. These are captains of industry.
Right.
They have got their own governing body. And for the private healthcare, we have got Datuk Jacob Thomas,
Who is the champion for
Yes.
the private healthcare sector.
And he's appointed by the National Productivity Council, chaired by the Prime Minister.
Okay, all right. So very quickly, talk to us about your role as champion.
Well, I'm to get together the various stakeholders, come up with the issues which affect productivity, and then find ways to resolve them. So that was a task which was given to me. So I was very fortunate that I was able to rope in the various stakeholders, private sector, public sector, industry, including agencies like Dewan Bandaraya, Bomba, Architects Association, and all of them together to come and see how can we improve the productivity of the private sector. So we got a lot of input, including from the Ministry of Health, and we were able to come up with different areas we need to focus on.
Latif, can I ask you about this, the objective? The objective, as you pointed out, is about spurring the economy, right? So these are not exhaustive. These 9 sectors are just the priority sectors. But the health sector is a curious one, and Malaysia gets even more curious because there is a public dimension to it, right? It's a public good in a way that perhaps other sectors might not be directly related to the lives of every citizen. There's also this other thing about the Malaysian healthcare system, which is that the government, through GLCs, is involved in the private healthcare sector. How do we make sense of this, that government is actually in the private healthcare system?
Yeah. You see, we like it or not, it has to be joint partnership with everyone, right? And you talk about public-private partnership. You see, we want people to do business easily in Malaysia. Now, healthcare is something that really touches heart of every Malaysian. Because if you make things difficult, you make people wait, longer, not just patient, even developers, is cost. It's cost. And cost will be passed down at the end to citizens. So that's why we need to speed up. We have to make procedures simple as much as possible. Investors are easy to come in and invest. Development can take place easily. Because if we are able to speed up all these things, it will help to reduce costs. At the end of the day, reduction in costs would also be experienced by public at large.
Okay, and I want to ask Jacob the same question really, which is to what extent, because it's often been said that the government in the health sector competes with itself. One, in providing public health care, and then through GLCs, through private initiatives, stakeholders, right? We have KPJ, we have even Ramsay Sime Darby has some investments from GLCs. Is the creation of a vibrant private healthcare system going to lead to the deterioration of the public healthcare system?
Of course not. because actually we've heard repeatedly by the government leaders, including the Minister of Health, that they want the private sector, private healthcare sector to take the lead. The government wants to sit back eventually and become just a regulator. And they want the private sector to be the one to provide healthcare centers, hospitals, and that is the way we are going through. So if you look today, the government of Malaysia is giving every possible encouragement to help the private healthcare sector to come up. And that is something which we are very happy about.
Why is it that this is private sector driven?
This because the government is a regulator. Okay. Ministry of Health is the one doing this. They've been trying many years now to do different things, but the government of today, just like the other 9 nexus, have said we want the private sector to take the initiative to move this forward. And I must tell you that I am very, very happy and positive that this is going to work, because in the 2 years that we've been working on this, we've already shown a lot of results, a lot of improvements, and actually the main people who are saying this is something we've been waiting for and you guys are doing it is the Ministry of Health.
Okay, all right, so let's talk about that. So, you've been working on this for 2 years. Clearly you have had a diagnosis of the problem. Where are the pain points that you've identified that you can look to increase productivity within the healthcare sector?
The main area I would say is in the construction of a hospital. In the past, it used to take about 800 days for a private hospital to get permission to be set up. And this is because there was no coordination between the Ministry of Health, between the fire services, between the architects, and as a result, there was a back and forth going on. 800 days because, and you submit a plan and it goes back and forth. They've counted up to 17 or 18 times, and each of those periods takes about a few months.
Okay, so 800 days in the process of setting up a new hospital.
That's right.
It takes almost 3 years.
And you got this land which has been bought by somebody lying empty, something they paid for in big money.
Right.
Right. You have in your initiatives outlined 3 distinct areas, right? Workforce performance, technology and innovation, and regulation. We'll get to all of them in the course of the next half an hour.
20 minutes, all right. Well, let's come back and continue this conversation shortly on increasing productivity within the healthcare sector right here on Consider This. Make sure you stay tuned.